Perhaps the biggest thing we need to consider during this quarantine is actually our health. But in talking about health, what are the things we need to consider? Health is it's not just medicine. It's a whole lot of factors such as fitness, diet, lifestyle, and maybe even your genetics. All these things come together in what we call life. Today, we will be talking to functional medicine certified health coach, Mitch Genato. Mitch is also the group CEO of the Romulus Health Group and, of course, life science.
Hi, John. Yes, thank you. Good afternoon. I am a functional medicine certified health coach. We are one of the pioneering groups who has brought functional medicine into the region. Life science has been around since 2010, although I'd say we didn't necessarily start with functional medicine. But basically, our business is a healthcare company that's been put up by non-doctors. So myself and my partners have put up the concept of life science from the perspective of patients, looking at global best practices in healthcare that we could bring to Filipinos and the rest of Southeast Asians.
Talk a little bit about functional medicine. What is it? How do you define that?
Okay, so functional medicine is a fairly young philosophy in healthcare. It's not a subspecialty. It's really more of a philosophy in healthcare, started about 36 years ago in the US. We'd like to take a look at healthcare from a perspective of systems biology, biochemistry, and genetics. And we'd like to really be able to bring it down and bring it home to 7 of the functions of the cells in the body. So if I may make an analogy in business, while a company may have KPIs and KRAs, the main KPIs of each of the 7 functions of each cell of the body is basically what we measure in being able to define a person's health.
Wow, at a cellular level.
Yes, so that's why we're talking about functional medicine. We're looking at 7 functions of each cell of the body. That's what we've narrowed it down to in functional medicine, to be able to navigate around living healthy and optimizing our quality of life.
These are words, that tend to hark back from high school biology. Why is it that when you go to a doctor, you hardly talk about these things?
Interesting question, John. So that was the question that sprung up from us when we first encountered the dilemma of putting up a healthcare proposition. So we were basically asking the question why, when you go to a doctor and you don't necessarily have a disease, it's as if your doctor is talking to you just to navigate around being able to pinpoint whether you're sick or not. But if you're generally healthy and you're looking to optimize your health, it's not necessarily a space that doctors are comfortable to speak about. The start of the pharmaceutical revolution, the main focus then were a lot of infections, much like the COVID situation that we're in now. And in trying to battle infections, rise of antibiotics, and the rise of a petrochemical industry has started to reshape what healthcare is. And that's where, you look at the history of healthcare as we know it from the US. They basically did a scan of all medical schools in the US and started to revolutionize that from a perspective of being able to use petrochemicals treating patients. Now, that's not necessarily a bad thing then, because the main issue of health, the main killer, were infectious disease.
Yes.
And rightfully so, in being able to obliterate and manage infectious disease, we needed to look at the use of such chemicals. But now, at this day and age, even with COVID around, you would see that a huge cause of death really in the population pre-COVID is non-communicable disease. But even interestingly, as you look at the COVID cases, the people who are not allowed to go outside are the elderly people above 65 now and the young kids. Well, it's because of comorbidities.
Yes.
So when you look at patients who die because of COVID, more often than not, it's because of comorbidities, because of a non-communicable disease.
Yes. It's something else besides the virus itself. Like
Yes.
There's some people that that
Diabetic,
survive.
or
I
you
mean,
have, yes.
there are some people that I know of who've actually contracted the disease, never knew they had it.